Hope you're having a great day. I want to thank you so much for spending part of it with us here on America's Retirement Headquarters, home of the Retirement Guys Formula and America's Medicare Associates with Nolan Baker and Scott Kirshner. My name is Chris Swan. Here's how I reach out. 419-794-3030. That's the phone number, 419-794-3030. Or if you prefer, always online, day and night, americasretirementheadquarters.com. On today's show, how concerned are you about your healthcare costs in retirement? We're going to talk about the opportunities that Roth Conversions have and how to know when it's the right time to start drawing Social Security, all this and more. But first, got to check in with the guys. Once again, Nolan, not with us on the road, but I do have Jeremy Baker and Scott Kirshner. So, guys, glad to be with you. How we doing this week?
Well, we're doing very well, Chris. Thank you very much. Jeremy, thank you for joining again.
No problem.
You're gonna
good to be here.
Yeah, you're gonna become a pro at this. Nolan is in Washington D.C. He got a special invite out there. Gets to meet with Michael Pence. So wished him luck. I sent him a little checklist of a few things I wanted him to talk to him about. But no, we're doing well. We're doing well.
Well, good. Glad to hear it. So let's jump into the show here, provide a little education, insight to the listeners and the viewers, and then also not just present the problems we may be facing in retirement, but hopefully offer some solutions. So let's dive right in. Amid all the turmoil that the markets are experiencing, there's an article that says the move into bearish territory could actually present an opportunity. We're always talking about opportunities in down markets here, and they're talking about a Roth conversion. So, guys, what are they, and what are the benefits here? What makes a Roth particularly attractive right now?
Well, Chris, a Roth IRA, couple things in case people don't know. What a Roth IRA offers is an opportunity for tax-deferred growth. Your money comes out tax-free after 59 and a half. It's not subject to RMDs like a traditional IRA. There's no income limitations for conversions. There are income limitations for contributions, but it does offer a great opportunity for conversions, especially with the market being down. For instance, if I own Apple stock right now on my traditional IRA or my 401k, and we believe in our investments, we feel that they are going to come back, well, you can convert a portion of your IRA to a Roth IRA. What you do is you pay the income taxes today at whatever tax bracket you're in, and then you can convert to a Roth IRA. You can experience that growth, again, tax deferred, and then when you take the money out, it will come out tax-free. So, if you believe in your investments and think the market will rebound, which I imagine it'll eventually will,
Sure.
then the opportunity's there for you to do a conversion.
So, Jeremy, you mentioned RMDs. For those that may not know what those are, required minimum distribution. So at 72, you have to take those, right?
Yes. At 72, the government says, you know what? You've been deferring taxes your entire life. It's time for us to have our fair share, whatever the government determines that to be.
Fair, yeah.
Fair share. Their fair share.
Right. It's a government calculation. It's roughly about 4% of what's in your IRA.
So one of the things that I want to jump in here and mention about Roth conversions is, with me being the health and benefits guy, the Roth money, the money that's put into the Roth IRA is not reportable income. So if you are under 65 and you want to do a conversion to a Roth, and let's say you've done that at 62 years old, you have a need for health insurance. The only option you have from 62 to 65 is you have two. You can go without, which I don't recommend, or you can sign up for the Unaffordable Care Act. And in doing so, the premiums are actually based on your income. I mean, what a novel concept that is, right? We're looking to insure your health, but we're not asking any health questions. We're basically saying, how old are you and how much money do you make? There's a couple of other questions like your zip code and where you live. But how are these insurance companies supposed to underwrite a risk if we don't ask what your health is? That was a novel concept by the wonderful people in government to come up with this Unaffordable Care Act. But if you have money and distributions that you're going to be taking out of a Roth, that does not constitute as income. Therefore, you could realize a higher premium tax credit, which in turn would lower your monthly payment for health insurance. So that's one thing, and even Medicare for that matter. If you are in retirement and you are taking money out of a Roth, that does not constitute as reportable income, which could keep you from paying an elevated premium for Part B. So those are things that are important to understand about a Roth conversion when it comes to healthcare as well.
Yeah, it seems counterintuitive to have your healthcare premiums based on your income rather than your health level, but we're not the government.
Well, it's like buying automobile insurance and not asking what your driving record is, right? I mean, you could have a couple of DUIs and 3 accidents, and hey, you're a great risk. Well, not really for the insurance company's point of view, but health insurance, you could be the most unhealthy person out there and still get health insurance at the same rate as the most healthy person out there, which doesn't make sense, but that's the way it is.
Right. One of the things I would say, instead of just blindly recommending a Roth conversion, we do what's called a tax roadmap here. We have some great software, and we do a tax clarity roadmap, which determines how much it makes sense in each individual case to convert. We have our tax brackets, so we want to make sure you stay in inside of a tax bracket and have a great opportunity. You don't want to enter into another tax bracket just by converting. It might make sense in some cases, but not in all. So I would encourage you to have a tax roadmap planned.
One thing I wanted to mention, I guess kind of ask you. So if I did a Roth conversion with the market at the the low that it is today, I pay tax on whatever money I convert, right?
Yes.
And then let's say that the market rebounds at the end of the year, like we all hope that it does, and I realize some significant increases in my portfolio in my Roth account. I don't have to pay taxes on that increase when I take that money out. Is that a fair statement?
Yes, that's a fair statement.
So that's a win-win. I mean, why would a person not be interested in doing that? I mean, I think that is just a good, makes sense kind of conversion. Wouldn't you agree?
Yeah, I talk a lot about tax invested assets, which are IRAs, 401ks, because eventually you're going to have that almost a ticking tax time bomb, because when you do hit 72, the government says you have to take money out. I look at maintaining control of my assets. I look at maintaining tax control. We have a bucket approach where, if you're going to take money out of certain assets, I think tax-free is probably the most advantageous. There's just some things you have to do to get into that situation where you can take your assets tax-free.
So all in all, there again, there's several different options, but with the volatility and the crazy market today, a Roth IRA is a good option and another means to an end, so to speak.
Absolutely.
But it's all about being methodical about it. There are certain things I think that we all assume and hope, or maybe not hope, but definitely assume. One, your portfolio is going to grow between now and whenever you do enter into retirement, whenever you do hit that RMD age. The R does stand for required. Please keep that in mind. You may not need the money. The government does. That's why they're there. So we can assume that our money will grow over time. We can also assume that taxes are going to go up in the future. It seems almost inevitable. The Trump tax cuts right now are set to sunset in 2025. Guys, that's not that far away. And at that point, even reverting back to the Obama level tax rates, that is them going up. So I think, especially with the market being down right now, where you can pay the taxes, you do have to pay the taxes, but you can pay the taxes at lower prices with the market law. This is one of those opportunities that the team at America's Retirement Headquarters, they're always looking out for, the opportunities that will make your money, stretch further in retirement. And again, because you do have to pay the taxes, it's not necessarily as easy as, well, let's convert the entirety of it, because that could push you in another tax bracket. That could be counterintuitive. So to figure out the right blend, or see if it's even right for you, pick up the phone, schedule a time to speak with America's Retirement Headquarters, have that tax roadmap run. 419-794-3030 is the number, or you can go online to americasretirementheadquarters.com. Social Security, another one of those things that people factor into their retirement, but maybe don't necessarily fully understand. And the 70 million Americans who receive benefits right now, they actually stand to get a pretty nice bump next year. A new estimate by the nonpartisan Senior Citizen League says inflation may push the cost of living adjustment to 8.6%, which will be a new all-time high following the all-time high that they saw last year. We often remind people that delaying taking Social Security past full retirement age gets you 8% more in benefits each year. So if you combine that with the increase, the projected increase in benefits, isn't it more important than ever to have that conversation, take a serious look at when you claim Social Security?
Well, the one thing that I want to add here before Jeremy explains this in a little more detail, one of the big misconceptions, and I run into this a lot when I deal with people that are looking to sign up for Medicare, it says when delaying taking Social Security past full retirement age, a lot of people come to me and they say, well, one of the things I ask them is, are you taking Social Security? And if they say no, I'm going to wait until my full retirement age. The reason why I ask that question is because if they're taking Social Security and they're coming of age of Medicare at 65, then their Part B premium is automatically deducted from the Social Security check. So I ask that question. But a lot of people think that I can't retire until full retirement age. That is not the case. If you can retire anytime you want, but to get a bigger bang for your buck with Social Security, you want to make sure that you wait until your full retirement age. So that doesn't mean you can't retire until 66 in 6 months or 67, depending on when you were born. It just means that that's when you want to start taking your Social Security to get that bigger bang for your buck. Do you run into that? I run into that all the time.
Absolutely. One of the things when we look at, I'm a certified Social Security claiming strategist, and we do a lot of seminars on when to take Social Security. And so there's a couple of things we look at. We do a scenario where we have a family that we call the earlies. They take Social Security early, which is at 62. What they do is they lock themselves into, for lack of a better term, a penalty, because their Social Security is reduced every year they take it before full retirement age. And then we have a situation with a family we call the laters, and those are people that wait till age 70, which is the longest you can wait to take Social Security. Well, you can wait longer, but it doesn't make any sense because you get an 8% increase every year you wait from 66 to 70. So that is about, with lack of compounding, about a 32% increase. And what we run into is a lot of people think, you know what, I can't work till 70. And nobody's saying you have to work till 70. What you want to do is consider delaying your retirement benefit where you can get that 8% increase that's fully guaranteed by the U.S. government. Now, there's a lot of arguments for and against. We look at break-even analysis and things like that. But the bottom line to me is there's most likely going to be a gap in your income from your income goals to what Social Security provides. And what I look to do is take a look at covering that gap using the least amount of capital possible. I call that having your cake and eating it too.
Who doesn't want that, right?
Right. When we look at Social Security being the cornerstone of your retirement income plan, let's just, for simple numbers, let's say your benefit's $24,000 a year or $2,000 a month. Now, if we look at safe withdrawal rates, and I don't want to bore people with numbers, but as Nolan likes to say, he's a numbers nerd, and we all kind of are in this profession. But having that benefit is the equivalent of having about $600,000 in assets. And if you looked at delaying Social Security for a few years, that 8% increase could kick your benefit up over $2,600 a year, or close to about $800,000 in assets. And so what I look at is not just having a retirement income plan, or not just having a financial plan, but a retirement income plan that takes you through retirement. If we talk about climbing Mount Everest, most people get to the peak, and the folks that end up not making it generally have problems on the way down. And I kind of equate that with retirement planning. It's getting to the top of the mountain and then navigating your way down is probably the most difficult. So what I like to do is devise a plan, take a look at that capital accumulation strategy, and find out when the right time for you to take Social Security is. Whether you're an early, a later, or somewhere in between, it's important to have that analysis done to take a look at what's right for you in your own situation.
And
Now,
it's
Jim-
different for everybody, right?
Oh,
I'm sorry. Go
absolutely.
ahead, Chris. You were going to say something?
Oh, no, I was just going to ask about the break-even analysis, because that is obviously, if you wait longer, you're going to get more benefit, but you have to continue claiming Social Security for a certain amount of time to make up for the benefits that you were missing out on from 62 to 70, right? What is there an average age where that break-even line is?
It's different for everybody, but
Sure.
Generally, it's, I would say, somewhere in the 81, 82. If you live past 81 or 82, you're generally going to be better off.
Yeah, I've had a lot of people that come to me with this question and say, well, I don't know, when should I take it? And I said, well, Jeremy's the guy to talk to, not me. But, if you do the numbers, simple numbers, I like simple, and if waiting until 70 is going to generate an additional $1,000 a month, you're only looking at, what, 3.5 years. If you can take resources from other areas, then what you have to do is look at what is that $1,000 a month going to get you from age 70 to, say, 82, 83, where that average is. And I think that's where a lot of people look at it and say, well, $1,000 a month is great, but I may not make it that long. And we talked about that before, everybody's situation is different. But that's where a lot of people have the confusion, is bridging that gap. And that, like you said, that's one of the things you do, is help them understand that bridging that gap and prolonging taking Social Security to get that additional 1,000 for the next 10, 11, 12 years.
Absolutely. And if I knew that somebody was going to pass away at, say, age 86, it's a much easier calculation.
Sure.
But my job is to protect you from taxes, inflation, and longevity. And we've seen it each and every day where somebody else is turning 100. And, people are living longer, much longer than they did in the past. Social Security wasn't designed for people to live to be 100. Back in the 50s, it was you retired, you collect Social Security, and 3 years later you passed away, and it made it easy on the system. Where there was more people paying in, the more people collecting. Now it's much different. People are living longer. There's less people paying in than there are people taking Social Security.
So I guess to summarize with that is, if you really are confused, and what most people are, reach out. You can talk to Jeremy. He'll be able to give you a claim strategy analysis on what's going to be best for you, and help divert that to maximize your Social Security benefit.
That's right. I want to clarify something just really quick. When Jeremy said that he protects people from longevity, that doesn't mean he protects people from living a long time. It's he protects them from the risk of living too long and outliving their savings. So that is something to keep in mind. Don't worry about that. I want to put that fear to bed. There has been a misnomer, I think, talking about the COLA, the cost of living adjustment that happens year to year. Like I said, we won't know the actual number going into 2023 until October or November or so. But I've heard people bill it as a raise, like, oh, I'm getting a pay raise. And that's not necessarily true. Last year was one of the highest. Like I said, it was 5.9% to offset. It is the cost of living adjustment. That's what COLA stands for, because things cost more. Inflation rate these days, it's 8 point something. So already being outpaced by inflation. So it doesn't even really keep up. So right now they're projecting 8.6%. What we'll actually see as far as inflation goes in next year, no one really knows. But this is something, don't think of it so much as a raise, just as a way to help kind of offset the fact that things cost more. And it's all the more reason to make sure you actually get the claiming strategy right. Jeremy, the team at America's Retirement Headquarters, they can help you out. All you need to do to get started, give a call, 419-794-3030, or go online to americasretirementheadquarters.com. Always available day and night right there on the website, americasretirementheadquarters.com. But how worried are you about healthcare costs when it comes to retirement? There's a recent survey that found 64% feel possible medical bills, they're going to be a prime factor that is preventing them from feeling financially secure about their future. Maybe that longevity risk we were just talking about. It doesn't happen to everyone, obviously, but what steps do you guys take to help them, alleviate those fears?
Well, that's a great point, Chris. And healthcare is it's on the rise. It's been on the rise for many, many years. I've been in this business. Well, September will be 28 years.
Wow.
I know I don't look that old, but I started when I was 10.
I was gonna say, yeah.
Yeah, but you know, there are some steps that you should definitely take to be proactive and to make sure that you are going to maximize the buckets of money you have. We've talked about buckets of money. We don't actually mean, you know, the pails or buckets that you walk around with, but you know, putting money aside in different buckets of money to pay for certain things that may arise unexpectedly during retirement. One of the things that we would advise you to do is maximize your workplace IRA or 401k contributions. That's always good, whether it's worried about healthcare or anything else. But the more money you can put aside into your IRA and 401k, you can use that money later on for Medicare costs. The other one that I've talked a lot about is contribute the maximum amount of money you can put into an HSA, health savings account. I love health savings accounts. I think they're a great tool. I think everybody should have one if they qualify. And in order to qualify, you must have a high deductible health plan. But this is a way that you can put money aside, tax-free dollars, and use it for any medically approved benefit. The one problem that people working past 65 are happening more and more today than ever is if you sign up for Medicare, just Part A, you don't even have to sign up for Part B, but if you're 65, you sign up for Medicare Part A because you have an employer plan, you can no longer contribute to an HSA. So you want to really pay attention to whether you want to sign up for Part A at all. It's free. So a lot of times there's no reason not to unless you are contributing to an HSA. That money can grow. I've got some clients that have $40,000, $50,000, $60,000 sitting in an HSA account. And, you know, great for them. They'll never have to pay a health premium or an out-of-pocket expense probably ever again if they utilize that money truly for health benefits. So keep in mind, anybody over 55, you can contribute an additional $1,000 catch-up, which is awesome. The amount of money that you could put into an HSA for 2022 is $7,300. If you're over, that's a family. $3,650 for an individual, and if you're over 55, you get that additional 1,000 catch-up. So if you have a husband or wife that are, 60 years old, contributing to an HSA, you can put in almost $9,300 in there. That is tax-free dollars when you take it out. Keep in mind of that. And the healthcare costs they're rising. I mean, it's just something that's happening. You have to be prepared for that. And if you're not, it could break the bank. It could drastically change the way you head down that retirement path, like Jeremy said.
It's no secret out there, everything costs more, and it's not necessarily proportionate. Healthcare, I think, is one that is significantly tilted towards the heavier side. So you need to take this into account. If you have concerns about healthcare costs that you could be facing in retirement, they're valid. But speak with Scott, speak with the team at America's Retirement Headquarters. Start developing a plan to, like I said at the beginning of the show, hopefully alleviate some of those concerns. Put pen to paper. Start developing that plan to take that on when it comes in. 419-794-3030 is the number. Now, Scott, it has been a couple months. We're halfway through 2022 already since I've seen any of those TV commercials by the Joes and the Jimmies. So Medicare commercials have significantly dropped down. So does that mean that we're good as far as Medicare goes until the AEP, the annual enrollment, starts up again in October?
So, Chris, are you telling me you're missing Mr. Dynamite, Jimmy Walker?
I mean, I can still watch Good Times. I'm okay if I'm really missing him. Yeah.
Actually, we're in a period right now for the next, for I guess the summertime, so to speak, would be where it's kind of quieted down. You're seeing some of those commercials still, just to let everybody know that they're still out there. They're still thinking about you, but they're not as every break from a TV show, you get a commercial about the same thing from all three of the different Joes.
Yeah.
So they are out there. One of the things that I really focus on more now is people turning 65.
Okay.
Because you're still, you don't just sign up during the annual enrollment period. You sign up when you turn 65, and you can make a change during the annual enrollment period, which is October 15th through December 7th. So I'm really focusing on that now. One of the things that I will mention quickly is there if you've signed up for an Advantage plan, one of the advantages to an Advantage plan is you get health care. You get people, custodians, that will actually call you from the insurance company and ask how you're doing. I understand you were in the hospital. You're now home. Is there anything that we can do to help you out? For those people that have meals, they'll deliver meals to the house. They'll ask you about your medications. So it's really kind of nice. I know I mention this just about every week, but I've been helping my mother out. She got a big box of 20 frozen meals delivered to her doorstep. And for her, it was awesome. Some of them she didn't like, so they're actually kind of tasty. But there's a lot of health advocates with these insurance companies that will actually call and check in on the seniors and make sure they're okay. There's some of the plans offer transportation to doctor's visits and things like that. So those are the kind of calls you're going to get more than a lot of the commercials during this period right now. So make sure that if somebody contacts you, you understand who where they're calling from and understand what they're saying. A lot of the problems when you run into the older seniors, like my mom's 84, she gets a phone call and she doesn't have any idea what they're talking about. She says, "My son's my agent, call him." I'm not asking all of my clients to call me or directly companies to call me, but I am here to answer any questions.
So there you go. People still do turn 65 outside of the annual election period. So it's never really a quiet time for Scott Kirshner. But if you have questions about Medicare or, what you could be looking for in the upcoming election period, he is available. Just give a call. 419-794-3030 is the number. You can go online, americasretirementheadquarters.com or americasmedicareassociates.com. Is that right? I haven't given out that website in quite a while.
Yeah, that is correct.
Okay. americasmedicareassociates.com is also the website. You are listening to America's Retirement Headquarters. We appreciate you joining us. We all have our big picture plans when it comes to retirement, but what if you're just looking for something to get into this weekend or to entertain guests when they swing by later this summer? Maybe check out our new restaurant. Well, after the break, we're going to talk to someone who should be able to help with that and are committed to the 419 segment when America's Retirement Headquarters continues.